Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Mel Speisman. He's an internal medicine physician. Today's Kevin MD article is How AI is Transforming Medicine Faster Than Ever Before. Mel, welcome to the show.
Kevin, thanks for having me on the podcast today.
So, let's start by briefly sharing your story and journey.
For sure. I'm internal medicine and I've been in medical education for 30 years and an active member and fellow of American College of Physicians. I'm from Chicago, did my undergraduate education at Northwestern University in biological sciences and chemistry. And then I did my medical school at the University of Illinois College of Medicine here in Chicago. And recently I took a position as an assistant professor at the University of Illinois in the College of Medicine Division of Academic Internal Medicine, where I got exposed to many invited guest speakers who were brought in by the dean or the chairman of medicine to give grand rounds or special, like Nobel Prize type winning lectures. And these speakers, during my time there in the last couple of years, the focus seemed to be on artificial intelligence and how to apply it to medicine. So that's how I got pulled into this. And then being inspired by what ACP does as a professional society, I realized for physicians like you and I, there's really no professional home right now for AI and medicine specifically. There are a lot of organizations that may include doctors in this space, but not a real home. So I actually stepped down from my dream job, from being an assistant professor at a medical school to launch my mini version of the American College of Physicians, which we call American College of Artificial Intelligence and Medicine. So that's my story, and I'm sticking with it.
All right. So, let's talk about your Kevin MD article, which discusses that intersection, of course, between AI and medicine. And it's evolved so quickly since it was introduced, ChatGPT, a couple years ago. So, tell us what this article is about for those who didn't get a chance to read it yet.
Yes, so the article is a very quick read that's very concise and tells you essentially all the key things you need to know as of today on how artificial intelligence is being used to care for patients. And what I really break it down into the following categories. How it blew up into medicine is what you said, that OpenAI released ChatGPT at 2 years ago, a little more than 2 years ago, in November 2022. Prior to that time, there was a decade worth of work in both ophthalmology and radiology on AI applications in medicine using machine learning, but it was very much under the radar. Physicians weren't really, unless you were an ophthalmologist or a radiologist, you weren't really aware that this was happening. And then when ChatGPT came out and the entire world saw this tool that can transform whatever it is they do, the uptake in the healthcare field was phenomenal, as you know. And if you look at publications, say in PubMed, and if you look at any specialty within medicine, prior to the year 2020, there were less than 1,000 articles on AI in any area, like maybe 700 at the most for since the entire history of medicine. And then since 2020, that less than 1,000 articles has blossomed into at least 5,000 papers or 1,000 per year. And the rate of growth of new data on AI in medicine is so exponential that literally no human being could possibly keep up with it. But our organization is focused on educating and doctors at all levels, where it's a medical student, a resident, a fellow, an attending doctor, anyone that wants to learn how to use AI to take care of a patient, we're that professional home to help sort through this massive amount of knowledge and information. So I think the thing that's really striking is that I'm in Chicago, and most of the major medical conferences are at McCormick Place in Chicago. We're actually going to hold one in September 19th and 20th, our own scientific session for artificial intelligence in medicine. But the cardiology conference is like AHA and American College of Cardiology, those are held here in Chicago at McCormick Place. The radiology conferences, radiology or RSNA meeting was in its 111th year this year, and I was there 1 month ago. The entire session was about how AI is being implemented in radiology, and I got to meet leaders from all over the world that flocked to Chicago McCormick Place to network, collaborate, and as you know, there's over 950, almost 1,000 FDA approved AI for medicine algorithms that could be used today. And every single one of those FDA approved algorithms was being displayed in the exhibit hall. And the doctors attending this conference and the healthcare leaders were all trying to decide, well, which one am I going to pick? Which one should I use? And so I'll turn it back to you, Kevin.
So tell us, for those physicians who may be outside the AI bubble and let's say in a patient care setting, because you said that AI before ChatGPT and OpenAI was primarily used in ophthalmology and radiology. Today, for those who aren't familiar with what AI can do, how is AI being used, say, in an internal medicine primary care setting today?
Kevin, I love that question so much. Thank you. So, in March of last year, we're coming up to about 1 year right here in Chicago. For example, Rush University and Northwestern University, and now the University of Chicago have all deployed in primary care medicine what's called ambient listening systems. And what this is an Alexa type speaker. It's not Alexa, but it's I just people know the Alexa speakers. So for those listening, I'm trying to make it basic. So if you took the technology of an Alexa type speaker and you put it in the patient room during the visit, the doctor no longer has to be glued to the keyboard or the screen. We could go back to doing what we love, what brought us to medicine in the first place, which is to build that doctor-patient relationship. We can maintain eye contact. We can read the emotions of our patient. We can give counseling and feedback in a very empathetic way now because we don't have to type everything in and click during the visit. We can not look at the computer at all. It will listen to the entire conversation, and before we even leave the room, it will have it generated in the electronic medical record, the full documented note of what happened, plus the problem lists, the plans, the potential medicines that need to be prescribed, the referrals to specialists. So this is amazing, and this has been implemented now for the last 1 year, and one in every three hospitals and health systems in America are currently using one of these ambient listening systems. So I'm fully not for profit. I don't take any funds from any brands, but I will just tell you, Rush partnered with a company called Suki, Suki. They purchased their ambient listening system from that company and deployed it in March. Northwestern, Abel Coe, who has his own department of AI in medicine, created its own system that Northwestern uses in conjunction with Microsoft. And most of the university hospital systems, other ones, many of them, and again, I'm not influenced by branding. I'll just tell you the one that's had the best uptake across the academic medical centers, such as the University of Chicago and others, is called Abridge. And they all basically do the same thing. They listen to the doctor-patient conversation and they link it into the electronic medical records such as Epic and generate an amazing document that is far better than anything that a physician can do. And so, I did primary care internal medicine at the University of Illinois for the last several years till I switched to being president of this AI organization. I will tell you, this is such an amazing thing because the burden on a physician to do the electronic medical record documentation at night, after hours, in your pajamas. I know, Kevin, you know this, you do it every day. It is just, this is literally such an impactful thing. So, this is how AI is currently being deployed and used. The other thing that is currently in that's done is many of the radiology departments have embedded in them scanners that have now AI put in there by the manufacturers that help with reading chest x-rays, reading CAT scans, reading MRI. So those are the two ways that it's actually happening today. But I'll turn it back to you for more questions, Kevin.
So I hear you when it comes to ambient AI scribes. And of course, full disclosure, my podcast's presenting sponsor is from an AI scribe company. So moving on beyond that, do you see AI having value in terms of the diagnostic approach, in terms of helping with the inboxes, kind of moving beyond scribing? Where do you see AI infiltrating a primary care physician's life past the documentation part?
Great. So I'll break it down into two parts. One is you mentioned the inbox. So once electronic medical records were fully implemented in the US, patients had a portal where they could send a message to their physician. This put a incredible burden on the doctor who's just trying to keep up with the notes from the visits during the day. They have to circle back into inbox messages. As you know, in practice, it's almost impossible to do your visits 8 hours a day and then document that for another 16 hours and do your inboxes. It's to a point where this kind of a burden has made many doctors like literally leave medicine. So I think we've solved it with AI, both with the note writing and with the inboxes. So right now, most of those same medical centers that have deployed the ambient listening system for note writing are also using it to generate a draft for the doctor to start with to then respond to an inbox question from a patient. But the doctor, just like the doctor has to read every word of the note in the EMR before they sign it, the doctor has to read the draft, modify it to that specific patient, and then sign it. But still, a tremendous benefit. Both of these things, as you know, are amazingly beneficial to the doctor and to the patient. So you could tell I have a lot of enthusiasm and I'm optimistic about the benefits of the things you mentioned. So you mentioned about the note write. I think the part about diagnosis is the cool part. And the centers that really are in the lead for decades on this are on both coasts. So, Harvard University and Zach Cohan's group and his Department of Biomedical Informatics and their New England Journal AI, that group on the East Coast, and then Stanford and their Center for Artificial Intelligence and Medicine and Imaging, that group on the West Coast, they both have done a lot of research on using AI to diagnose rare diseases. And Zach actually has a rare disease research program that's nationwide, that's funded through the NIH, where anyone with an undiagnosed disease can, for free, get enrolled in this program, and they will use AI to help diagnose someone that maybe has gone 10 years, 20 years without a diagnosis. And there's so many examples of patients who maybe have seen 10 or 15 doctors without a diagnosis. And if that same information is entered into a large language model, such as ChatGPT or other ones, all of a sudden the diagnosis is made. So to me, this is the true power of what we can do with large language models. And there's one woman who is very prominent in this regard who went and then most of the people at my level who speak on this use her example where she saw 12 different doctors because this has been well written up in the medical literature. She saw 12 different doctors for her child. No one could solve it. She put it into ChatGPT herself out of frustration, had an answer, then went to the proper specialist. The child underwent a surgery on his spine and was cured when no one could help this child. So that is a really heartwarming story in terms of the power of what AI could do to help people who are undiagnosed or have rare, unusual diseases. One of my mentees, I've taught over 1,500 students and residents. One of my mentees who works with me in the AI space said he's got a son. His son is 22. He's had no one has been able to figure out since birth what his son has. He told me all the symptoms. I put it all into ChatGPT. I had an answer in seconds. This is like incredible. This is my own colleague physician who is, we have two doctors that are parents who cannot, with the in knowing the medical system and being on the inside for 21 years, could not have a correct diagnosis for their child, and in 60 seconds I had the answer. So I hope these examples that I gave you on diagnosis inspire you to want to use it as a tool to really help patients. So I'll turn it back to you.
So I was listening to Mark Zuckerberg on a recent podcast, and he said that the current state of AI is on par with a mid-level coder at Facebook. Of course, a statement like that put the fear in a lot of computer science graduates, wondering if they're going to have a job coming out or if AI is going to take their job. Do you see the same thing happening in medicine where the diagnostic abilities of AI become so good that health systems are simply going to replace physicians with cheaper AI alternatives? And what does that threat mean to our livelihood going forward?
Great question. I have a very clear and clean answer to that. The simple answer is no, it will not replace physicians. I speak and teach about AI virtually every day at medical schools and hospitals. And what I want to tell you, I want to give the same message to my mentees that I want to give to your listeners, which is AI is a tool like the stethoscope. It's not going to replace doctors. It's simply going to be a powerful tool like a stethoscope that will allow us to diagnose and treat patients in ways unimaginable, but it will not replace you. It will always require physician supervision. And you and I both know that there's hallucinations, which means it needs supervision. So, my message to my students and residents and faculty that I teach is you always have to supervise AI as if it were your medical student. A medical student can write a prescription, but they can't sign it and it can't be filled unless the attending doctor co-signs it. So that's how I want you to think about AI. Whether it's now or a decade from now, it's like your medical student. It can help you, but you have to read every word, check for mistakes, check for hallucinations, and in the end, you are signing off on it that what it put out is correct. And it may not be correct. So that's why you have to read every word of that ambient note and not just click sign. And you have to supervise it as if it were a medical student, knowing that there could be a mistake and that your role as a physician is to oversee it as the teacher, as the faculty member, as the attending doctor, and you must advocate for your patient and check for errors. And there can be errors, as it's well known that there can and will be errors. And this term of hallucinations is a really serious issue. And that's why we're all approaching it in a way where we're being very cautious. We want to make sure there's safety. And I've been advocating through our organization, the American College of Artificial Intelligence and Medicine, for an evidence-based approach to this. So right now, the 1,000 FDA-approved AI algorithms, very few have been tested in the evidence-based medicine that you and I use for pills. Like you and I would never give a drug to a patient unless it withstood the rigors of a randomized trial. So our organization at our national meeting in September, it's going to be the evidence-based medicine approach to using AI to care for patients.
We're talking to Mel Speisman. He is an internal medicine physician. Today's Kevin MD article is How AI is Transforming Medicine Faster Than Ever Before. Mel, let's end with some take home messages that you would like to leave with the Kevin MD audience.
Great. Number one, don't be afraid. The more knowledge that you get learning about AI and medicine, the less fear you will have. The only people I know that are fearful of AI in medicine are those that haven't educated themselves about that. So, as physicians, when developments occur in medicine, what do? We read the articles, we learn the new data. You have to apply that to AI now because thousands upon thousands of articles are being published every year right now on AI for medicine. Use the same techniques you've used in your entire career. Learn about it, then you won't be afraid of it. Use it as a tool to help patients and improve care and save millions of lives worldwide.
Mel, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Kevin, it's such a pleasure. And I want to thank you for the amazing work that you do to get the message out and to educate not only physicians, but the general public about the important topics in medicine. Really, bravo to you for this podcast and for your website and all that you do to teach. And it's really something that I am just so honored to be part of today. So thank you for what you do.
I appreciate the kind words, Mel.